The second bone that I'd like to cover is the scapula. The scapula is also known as the shoulder blade and plays a very important role in the shoulder complex for a couple of reasons. One, and really the primary reason, is it's an attachment site for a lot of very important muscles that help to stabilize the glenohumeral joint. Also, the scapula, the fact that it basically can float up and down on the rib cage as well as moved side to side, we'll see affords this region a great deal of mobility. So the scapula is a flat, loosely triangular bone that sits up against the rib cage. The scapula we can see in this picture here, and we can see how it is, again, loosely triangular with 3 sides and 3 angles. And we'll see that they're actually called borders and angles because of the fact that it looks triangular. It sits typically at rest on the rib cage. So when the person's in anatomical position, it basically lines up with thoracic vertebrae 2 through thoracic vertebrae 7. And that's always a good landmark, or those are good landmarks to use because it's easy to identify those spinous processes for the thoracic vertebrae and tell if maybe somebody has a high riding or low riding scapula. Often we may see this even unilaterally, potentially because of their sport utilizes one arm more than the other, or because of muscle tightness or weakness. The scapula provides a location for attachment of a number of very important glenohumeral muscles that cross the true shoulder joint. And again, they're going to originate on the scapula, but then hold the scapula and the humerus together and provide a good bit of the stability that we see in this region. In this region, the muscles provide a much greater stability function than a lot of other regions, as we'll see as we move through these presentations. So when we look at the scapula or the shoulder blade, we can see a number of important landmarks. First off, when we look at the posterior aspect of the scapula, we see a structure that's called the spine of the scapula. We could palpate this very easily on the posterior aspect of our shoulder. It's this bony, ridge that runs from the medial aspect of the scapula all the way out to the acromion, or that tip or point on the top of our shoulder complex. So the spine of the scapula is going to be an important landmark to find. It's really easy to palpate it, and then that also is going to help us identify the location of certain muscles as we move forward in this presentation. The area above the spine of the scapula is a valley or a hollowed out area. In anatomy, often those hollowed out areas are called fossas. So this area above the spine of the scapula is called the supraspinous fossa because it's superior to or above the spine. And then the area below the spine is called the infraspinous fossa. And we're going to see a couple muscles get some names from those locations, the supraspinatus and the infraspinatus. They're named because they sit above or below the spine of the scapula and sit in these fossas. Now, there's some other important landmarks as well. We'll see that the end of the spine of the scapula is called the acromion process. So the end of the spine is called the acromion process. Again, very easy to palpate this structure. It's on the top of the shoulder complex and so on. Person, if they fall and land on the top of their shoulder, they're basically hitting the acromion process. And then the whole rest of this kind of triangular portion of the scapula, the whole rest of it is called the body of the scapula. So the spine of the scapula sits upon the body of the scapula. Now, the body of the scapula has a number of important landmarks that I want to talk about. First off, I mentioned borders earlier. Basically, the 3 sides of this triangle that the scapula forms each have a name. Each border has a name. So we have a medial border of the scapula that faces medially. It's going to be in close proximity to the spinous processes of the thoracic spine. Then in the armpit region, or the axilla, we have the axillary border. Faces the armpit, faces the axilla. And then the top border is called the superior border. So 3 borders of the scapula since it forms a triangle. Now, since it forms this triangle. We also have angles, remember back from geometry, like there are 3 angles in a triangle. This angle, again, basically where the superior border and the medial border come together is called the superior angle. And then the inferior angle is the location where the axillary border and the medial border come together. So those are 2 angles that are formed. The third angle really is over here, obviously, and is the glenoid. It's basically where the humerus is going to articulate with the scapula, but they don't call that necessarily one of the angles. So those angles are important as well. Also, again, if you're attempting to kind of look at the location of the scapula, we can easily palpate the superior angle and the inferior angle, and then look to see where they fit in or sit in regards to the spinous processes of the thoracic spine to see if our scapula is riding high or low. But they're easy to palpate. A couple other important landmarks that we see more on the anterior aspect of the scapula. First off, the whole anterior surface of the scapula is called the subscapular fossa, sub meaning under, because that's the portion of the scapula that you can't touch really, right? It sits up against the rib cage. So that's called the subscapular fossa. We also have a landmark that points anteriorly. That's called the coracoid process. That's this structure here, kind of a finger-like projection that points anteriorly. If you palpate along the anterior deltoid, you can feel that coracoid process that points anteriorly. It's kind of deep and it's kind of uncomfortable to palpate. And then the last landmark on this slide is the glenoid cavity, and that's this aspect here. It's actually the articular surface, the portion of the scapula that's going to articulate with the head of the humerus and form the glenohumeral joint, and that's called the glenoid cavity. Now, we will get more into function later in this series of presentations, but I like to give you at least a glimpse of what's coming. But basically, the scapula and the clavicle work as a functional unit. As I said, we basically, for the shoulder complex, we have the glenohumeral joint, which a lot of people think of as the shoulder, but we also have the shoulder girdle, and the shoulder girdle is going to be the clavicle and the scapula, and they function together like a functional unit. They kind of correlate to the pelvis, and they provide this base of support for the glenohumeral joint, just like the pelvis provides this base of support for the hip joint. The clavicle and the scapula basically are going to work together to enhance total shoulder motion. So we're going to see that they move, right? Unlike the pelvis, which is not movable for the most part, we have a lot of motion that occurs between the scapula and the clavicle, and they basically work as a unit. So, for instance, if you were to do a shoulder shrug, right? What's happening when you do a shoulder shrug? Your scapula and your clavicle both are moving upward, right? So they both are sliding upward. The scapula is sliding on the thorax or on the rib cage, and the clavicle is tilting upward to allow for that to occur. If you put your arm up over your head, we get a motion like this, where the scapula is going to rotate in an upward direction, and along with it will come the clavicle. So the scapula and the clavicle serve a really important function to the shoulder complex as a whole. First, a stability function because they connect the upper extremity to the trunk. The scapula is connected to the thorax via muscles for some stability. And then, as I mentioned before, the clavicle's connected directly via a synovial joint to the sternum and to the axial skeleton. So they form an important stability function. They also form and create an important function of creating this kind of base of support for the humerus and then the whole upper extremity. And then finally, they provide an important mobility function. As I had mentioned, they move as we move the shoulder as a whole to add to the stability and function of this region as a whole. So they allow for movement of this base of support for the whole upper extremity. So we're going to see both, again, very important stability functions and mobility functions from the scapula and the clavicle. Lastly, on the scapula, I want to talk a little bit more detail about the glenoid fossa. We saw it from the side before, which really doesn't do it justice. So what we're looking at here is the humerus has been removed. So normally the humerus would be sitting here, right? But we've removed the humerus. And now we can look directly at the scapula from the side. So let me point out a couple important factors or features before I get to the actual glenoid. So when we look at it from this view, we're looking medially from the lateral aspect of the shoulder. We can see the clavicle from the side here. We can see where it connects to the acromion process. So the clavicle and the acromion process form the acromioclavicular joint there, as we'll see. We can also see, in addition to that acromion process on the scapula, we can see the coracoid process here, which is that finger-like projection that points anteriorly. And again, remember, this is going to be anterior, and this is posterior over here. And then this is obviously going to be the axillary border of the scapula. And then we could see a couple important structures such as the triceps tendon and the biceps tendon and so on. Okay, so when we look at the scapula from the lateral aspect, looking medially, we can see this round socket. That's called the glenoid fossa. That's where the head of the humerus is going to articulate with the scapula and form the glenohumeral joint. That socket is very shallow. It's a very shallow socket, unlike the socket that's formed for the hip joint. So again, this socket, because it's so shallow, it leads to a lot of mobility, but at the sacrifice of stability. So again, it's a very shallow socket. Around the edge of this, I know we're getting ahead of the bony anatomy, we have a cartilage structure that's called the glenoid labrum, which makes the socket deeper and makes the joint itself, the glenohumeral joint, more stable. So again, we have a very shallow socket called the glenoid fossa that's deepened by a structure called the glenoid labrum. It's deepened by approximately 50%. It's tilted somewhat upward relative to the vertebral border, which again makes it a little easier for the joint to stay stable. You know, it's easier to hold stuff in a cup when the cup's pointing upward. If the cup's pointing downward, all of the stuff comes out. So in this case, the socket's pointing a little bit upward, which adds to the stability a little bit, holding this joint together. It's more narrow on the superior end and a little wider down at the bottom end, and therefore it kind of has this teardrop appearance, which you can see in this image. And then it's tilted somewhat anteriorly, again favoring the humerus moving in an anterior direction as opposed to posterior direction. And again, that's because we mostly do stuff in front of us, not behind us. And again, that's often called, that anterior tilt and upward tilt is often called the plane of the scapula. So a lot of times when we see people doing shoulder exercises, they aren't doing necessarily directly anterior or directly laterally. They're doing them at a slight angle in front of them, and that's called the plane of the scapula. We'll talk about that more when we get to the muscles and specifically to some of the different motions of this region. But the glenoid fossa is a very important structure functionally for the shoulder complex, because that's where the head of the humerus is going to articulate with the scapula or with the shoulder girdle. That's where most of the motion of this region occurs, is between the glenoid fossa and the humeral head.